Have you ever heard about acute flaccid myelitis, a polio-like illness mainly affecting children? This is not just a simple question, but a call to awareness about a significant health challenge that has been affecting children across the globe since 2012. Acute flaccid myelitis, often abbreviated as AFM, is a disabling disease that can invoke profound muscle weakness in its victims. And yes, it's as serious as it sounds. This weakness can lead to respiratory failure and other critical complications, mimicking several other acute neurological illnesses. The seriousness of AFM cannot be overstated. What makes AFM a major public health challenge is its nature and the scope of its impact. Global outbreaks have occurred, affecting children in multiple regions. The cause? It appears to be an infection from a non-polio enterovirus. This is an issue that requires our attention and understanding, as the disease does not discriminate in its targets. Diagnosing AFM is not a walk in the park. There is no single sensitive and specific test for it. The diagnosis relies on the identification of several important clinical, neuroimaging, and cerebrospinal fluid characteristics. After the acute phase of AFM, patients typically face a long road of recovery. They are left with substantial residual disability and unique long-term rehabilitation needs. This is why understanding AFM is so crucial. It's not just about the immediate effects, but also the long-term consequences. But it's not all gloom and doom. The more we understand about AFM, the better equipped we are to manage it and improve outcomes for those affected. Research is ongoing, examining factors such as genetics, viral characteristics, host virus interactions, and potential therapeutic approaches. As we delve deeper into this subject, remember this: knowledge is power. The more we know about AFM, the better positioned we are to recognize its symptoms, seek immediate medical assistance, and ultimately safeguard the health of our children. Understanding AFM is crucial to identifying its symptoms and seeking immediate medical assistance. Now, you might be wondering, how does this disease manifest? What are the symptoms of acute flaccid myelitis? The onset of AFM can be quite subtle, often beginning with a mild respiratory illness or fever caused by a viral infection. This happens typically about 1 to 4 weeks before the more severe symptoms start to appear. It's important to note that this initial phase might seem benign, much like a common cold or flu, but it's a precursor to something far more serious. As the disease progresses, more alarming symptoms start to unfold. The most common signs include sudden arm or leg weakness, a loss of muscle tone, and a sudden loss of reflexes. These symptoms indicate a profound muscle weakness, which is a key characteristic of acute flaccid myelitis. However, AFM doesn't stop there. Some individuals may also experience difficulty moving the eyes, drooping eyelids, facial droop or weakness, and difficulty with swallowing or slurred speech. There may be pain in the arms, legs, neck, or back. Uncommon symptoms might include numbness or tingling and an inability to pass urine. In severe cases, the disease can lead to respiratory failure, as the muscles involved in breathing become weak. Life-threatening body temperature changes and blood pressure instability can also occur. These symptoms are a clear indication that immediate medical attention is needed. The symptoms can progress rapidly, and that's why it's crucial to seek immediate medical care at the onset of these symptoms. Hospitalization may be needed, and in some cases, a ventilator may be required for breathing support. It's important to remember, however, that the symptoms of acute flaccid myelitis can look similar to those of the viral disease polio. So, if you or your child has any of the signs or symptoms we've discussed, it's essential to seek medical care as soon as possible. Early detection of these symptoms can be life-saving, and that's why it's important to know what to look out for. What causes acute flaccid myelitis? Who are most at risk? These are critical questions as we venture into understanding this disabling polio-like illness. The exact cause of acute flaccid myelitis, often abbreviated as AFM, is still a subject of ongoing research. However, one of the primary suspects is a type of virus known as the enterovirus. Enteroviruses are quite common, especially among children, and often result in respiratory illnesses and fevers. But here's the puzzle. While most people recover from these infections, a small fraction develop AFM. This leads us to an intriguing question. Why do some people develop AFM while others don't? The answer isn't clear-cut, unfortunately. It's like a complex jigsaw puzzle that researchers worldwide are tirelessly working to solve. There could be a multitude of factors at play here, including the individual's genetic makeup, the specific strain of the virus, and the person's immune response. Now let's talk about risk factors. AFM is a non-discriminatory disease and can affect anyone. However, it has a particular predilection for children. Outbreaks of AFM have been recorded across the globe since 2012, predominantly affecting the younger population. It's important to note that while children are more susceptible, adults aren't entirely immune. The reasons behind this age-related susceptibility aren't fully known. One hypothesis is that children's immune systems, being less mature, might react differently to the enterovirus infection, possibly leading to AFM. But again, this is just a hypothesis and more research is needed to validate it. In the end, the story of acute flaccid myelitis is one that's still being written. It's a complex narrative of viruses, immune responses, and genetic factors that we're only beginning to understand. But one thing is clear: knowledge is power. The more we understand about the causes and risk factors of AFM, the better equipped we'll be to prevent and manage this disease. While we still have a lot to learn about AFM, understanding its causes and risk factors can help us take preventive measures. So, how do we treat acute flaccid myelitis? That's a question that continues to challenge the medical community. You see, there is no specific targeted treatment for AFM that's universally recognized or preferred. This is due to the complex nature of the disease and its varied presentation in patients. And this is why there is a pressing need for more research and clinical trials to explore effective treatment options. What we do have, however, are treatments that have been used frequently and have shown some promise. Let's delve into these a little bit. One such treatment is intravenous immunoglobulin. This is a blood product administered through a vein, and it's packed with antibodies that can help to fight off infections. It's often used when the body's immune response is compromised, as is the case with AFM. Next up, we have corticosteroids. These are a type of steroid hormone that reduces inflammation and suppresses the immune system. They can be administered in various forms, but for AFM, they are often given intravenously. By reducing inflammation in the body, corticosteroids can help to alleviate some of the symptoms of AFM. Lastly, there's a procedure called therapeutic plasma exchange. This involves removing, treating, and returning the blood plasma in a person's body. The idea here is to remove the elements in the plasma that might be causing the disease, and then replace it with healthy plasma. It's a more aggressive treatment and is typically used in severe cases of AFM. But remember, these treatments are not cure-alls. They are part of an overall approach that includes supportive care, which can involve physical and occupational therapy to help regain muscle strength and function. Despite the challenges, it's important to remember that early detection and immediate treatment can make a significant difference in the outcome. So, while we continue to search for more robust treatment options, we can still offer some level of hope to those affected by acute flaccid myelitis. Let's take a moment to summarize what we've learned about acute flaccid myelitis today. Acute flaccid myelitis, commonly referred to as AFM, is a rare, serious illness that affects the nervous system, particularly the area of the spinal cord called the gray matter. This leads to a sudden onset of paralysis in the limbs. The disease primarily targets children and has been likened to polio due to the similarity of symptoms. The common signs of AFM include sudden weakness in the arms or legs, loss of muscle tone and reflexes. Other potential symptoms may encompass difficulties with eye movement, drooping eyelids, or facial drooping. Some may experience trouble swallowing or slurred speech, and in severe cases, respiratory failure can occur due to weakened muscles necessary for breathing. The cause of AFM is believed to be linked to an infection with a type of virus known as an enterovirus. However, why some people with an enterovirus infection develop AFM while others recover remains unclear. In terms of treatment, there is currently no specific targeted approach that is either preferred or avoided in the acute medical treatment of AFM. Commonly used treatments include intravenous immunoglobulin, corticosteroids, and therapeutic plasma exchange. However, it's important to keep in mind that these treatments are based on case reports and case series, and there is a lack of prospective clinical trials on treatments for AFM. The key takeaway from our discussion today is the importance of early detection and immediate medical care. If you or a child shows symptoms of AFM, it's crucial to seek medical care as soon as possible. Symptoms can progress rapidly, and in severe cases, hospitalization may be required. Remember, knowledge is power. Stay informed, stay safe, and help spread awareness about acute flaccid myelitis. Until next time, this is Divine Nutri signing off.